Welcome to BizTech's Health and Wellness Show. Now, our guests for today are Mark Leong, Chairman of Osteopore, as well as Dr. Lim Jing, COO and CTO of Osteopore. Osteopore Limited is an Australian ASX-listed company with R&D and manufacturing in Singapore. Now, it's a truly global leader in the manufacture of innovative regenerative implants at commercial scale. Now, Osteopore produces medical implants to meet the needs of both tissue and bone reconstruction, as well as restoration. Now, to tell us more, welcome to the show, gentlemen.
Thanks, Brian. Thanks for having us.
Now, okay, Mark, for a start, could you shed some light on Osteopore and what it was set up to do and its history?
Well, we have our roots with the Singapore universities, and the technology behind it really was to promote natural healing, tissue regeneration. So that's as the anchor of the technology, we use 3D printing. We print using a bioresorbable material. So what that means is that it's friendly to the body, right? You put it into the body, it dissolves naturally over time into harmless water and carbon dioxide. So using 3D printing, we printed special scaffold, which mimics the microstructure of porous bone. And when you put it in the body, we create this perfect environment to facilitate the body's own natural healing abilities. So with this technology, it really replaces the need for artificial implants, because there's nothing better than having your own bones be grown naturally.
And that's really good, because obviously that helps clinical outcomes, aids recovery, and so forth. But could you give us an idea of how the research out of NUS and Temasek Poly, for example, was translated into a commercial scale?
Yeah, Brian, maybe I'll take that. I think back in those days, one of the most explicit images that we could see of the internet was that of a human ear grown on the back of a mouse. Mm-hmm. And that very vivid image actually inspired a lot of engineers and clinicians to work collaboratively together in order to create what is called a tissue engineered solution. So about a few years after that that successful experiment, our co-founders got together, 6 of them, 3 clinicians and 3 scientists and engineers, got together to put in place a plan to create a 3D printed device that would completely change the way patients are healed. So after about 7 years of R&D, then the company was formed, and a couple of years later, we took the product to the market.
And now you currently have offices in both Singapore and Australia. Besides those 2 markets, where is your presence, and who generally utilizes your products and services?
We have a global presence as it stands. We are approved in the US, in Europe, in Australia, most parts of ASEAN. And as at the end of 2021, we have a cumulative total of 60,000 implants that have been out there in circulation in patients. And we're happy to report that patients are doing well with an extremely low complication rate as compared to other devices. And a lot of patients have seen the benefit of using our devices. Right? We have successfully restored patients' quality of life after the surgeon has applied our devices into patients, the largest of which was a 36-centimeter reconstruction of a shin bone that enabled the patient to walk again post-surgery.
And that's quite incredible. 36 centimeters is a very huge. Could you give us some insights into the different bones and different surgical procedures that perhaps have impacted patients' lives?
Sure. Yeah, as I was saying, that 36 centimeters of shin bone was really a very landmark-ish in nature, because the patient was actually given the option, a very negative option of amputation above the knee. And we went about this planning process with the surgeon in order to reconstruct or grow that extensive amount of bone in the patient. Apart from that, we've also treated some patients who had a very large skull defect after a traumatic accident. And post-surgery, this patient in Australia can now take part in activities of daily living. He can go for swimming. And in fact, he recently completed one leg of a triathlon. And he has dreams of going even further and becoming even better at the swimming leg of that event. So I think by and large, we've touched patients in different ways. Recently, we've also helped to regrow part of a heel of a patient in Singapore after he suffered an accident. And I think these are just some of the ways in which we try to empower patients to come out of a difficult situation.
So Dr. Jing, this is really interesting because a lot of times the options that seem to be in many countries, it's around either amputation, which is the worst case scenario, or then basically putting in a titanium implant or something like that. Could you kind of shed some light in terms of how tissue regeneration technology has really evolved to this stage, and how long is the recovery process in order to achieve the outcomes that you've just mentioned?
Sure. I think you're right to say that a lot of the current treatment methods would unfortunately include one option of amputation, and involves a lot of metallic components, metallic hardware that is placed into the patient. Especially in cases where a lot of bone has been lost, sometimes the metal implant is insufficient. They may require a procedure also known as bone grafting. Bone grafting actually takes bone from another location in your body and transplanting it to the site where bone is lost. So what our device and our technology is able to do is to, in some way, reduce the dependence on bone grafting, so that we retain and we keep as much of the original bone as possible, but we use our devices to help the patient grow back bone. In a way, it has helped to change the way surgeons treat patients and how patients can recover from a very traumatic procedure. Some of these patients actually would be able to walk better with our devices because now in this case, patient grows back their own bone. In other situations, they may even be empowered to just go back to normal living, getting back their quality of life. I think as we continue to evolve and explore new applications, surgeons regularly find innovative users with our devices. We engage in a very deep conversation with them so that we can continue to further the impact of our technology.
Now, it sounds like, this has really, in many ways, revolutionized the treatment of the patients because you have better medical outcomes, as you've pointed out, and also, obviously, the fact that it is less invasive overall compared to other methods. For example, as you said, putting metal bits inside your body. But can I ask, in terms of the development of the bioprinting technology, when was the point of inflection when all of this became possible and cost efficient as well?
That's a good question. I think we have to go back a little bit into history to answer that properly. But I think we would put a finger around maybe 20 years ago, thereabouts. And that's also about the point where Osteopore started looking into this and becoming the first in the world to commercialize such a technology. We've seen a lot of development in all the complementary technologies that would allow or enable this technology to come into life, because otherwise it always remained as a research concept, mostly in the academic sector, where we could grow tissues in the lab. But to really implement it and impact patients' lives, we had supporting technology coming from 3D printing, from the regulations point of view, right? And Osteopore is proud to be the first in the world to actually leverage on such access to technology and regulations in order to bring the product out into the market. So it's been a few years, quite a few years to come into this space. But I think right now we are really primed and at the forefront of technology to continue to push the way patients are treated.
Then, Dr. Jing, I'm curious, why isn't this more ubiquitous across the region and across the world?
I think whenever we come in with some impactful technology and something that's a little bit different from what surgeons have been doing, given that this is an implantable, so many surgeons would take some time to understand the technology, to use it, experience it before they adopt it into regular practice. So what we've been doing over the past couple of years is really to drive this initiative, getting the message out there, getting the surgeons to understand how the technology works, sharing with them the good clinical results that we have achieved. In fact, on this point, we've released a 10-year clinical experience of using our devices, and that's in a peer-reviewed journal.
Mm-hmm.
So these are additional information that helps the surgeon to make the right decisions on whether or not to adopt the technology and apply it to the right setting.
Now, Mark, I want to pose a similar question to you. It sounds like this is great technology. It has, a 10-year, you've done a 10-year study. So basically, there's a not just proof of concept, but there's really experience curve effects, there's clinical data, there's patient information. Why hasn't this been more successful, Mark? What do you think you would have done differently in terms of building Osteopore as a brand and as well as commercializing this technology?
Well, Brian, I guess it's first of all, most surgeons, that are practicing now never had access to our technology, right? It is not, something they studied in medical school. And because of the way, medical procedure surgeries happen, you have a proven technology, unique clinical data. It is a process. We can regrow bones, right? But head to toe, we got bones, but every body part is a particular process. You got to have clinical trials, get clinical data, and then you got to submit it in particular jurisdictions, US FDA, Europe CE, Australia TGA. So, it is not selling it in a supermarket where, they just pick it off the shelf. It is a process for each area, regulatory process, approvals, and then with that, you talk to the doctors, you talk to the surgeons and distributors, and it's an educational process. So it takes time. It takes time, but over time, there's greater adoption. Like Jing alluded earlier, we have 10 years of clinical data, so it is not something that is unproven, but there is a process to getting this take-up rate, and but we are encouraged. Like we shared recently, we have more than 60,000 surgeries done. Right, we are in every continent in the world. We have really pushed our product out more aggressively in the last 3 years. That's when we got listed in Australia. But having said that, I think we have to remind people that, the bulk of the last 3 years have been during COVID. So, that slows down many things. But we are seeing great adoption and pickup rates and great interest. So we are fairly enthusiastic over, the coming few years.
And what's the strategy then in the next couple of years? Is geographical footprint expansion in the cards as well?
Yeah, Brian, we are in more than 20 countries globally in every continent. But we are a small, medium-sized company. We are growing, so the focus is really on the US market. Right, it is the largest market, and once you get that sorted out, everything flows. So geographically, we're looking into the US, and obviously the Chinese market is next biggest market. Having said that, obviously we are based in Southeast Asia, so that's always a place we never forget. And in terms of applications, right now we got a lot of approvals on the neck up, the craniofacials and things like that. We are looking into other applications, for example, orthopedics. Like Dr. Jing shared just now, we did a world's first in growing a 36 cm shin bone. So that's fantastic for the length and its load bearing. And then we are going after the aesthetic market, right, for nose and things like that. And as well as the dental market. So these are new applications that are in relation to both.
Looking ahead then, Mark, as a leader in the healthcare space, you're in a hot sector. in terms of a space. How do you see this growing, this whole industry? Where are the opportunities in terms of healthcare and with relation to your business?
I think the opportunities are huge. We're just talking about bone right now. We're just talking about bone, right? But do not forget, our technology is actually, we empower natural tissue regeneration. So as the further developments to our technology, right now we are just enhancing, right? We are just encouraging the bone's natural healing ability, the body's own natural healing abilities. We're now looking towards developing how to speed up that process. And that's going to be very exciting if you can speed up bone regeneration. And they're just bone. We have done animal studies to regrow tendons, ligaments, and other soft tissues. So these are the next wonderful opportunities. Imagine we could replace, people like us over time, we do a lot of running. So our knees is going to go over time. And so we could replace our wonky knee cartilage. So these are step 2, step 3, step 4 in the evolution of what Osteopore can do. So, the endless possibilities that we are trying to take step by step. But whilst we commercialize, doing R&D is a constant process of sharpening the saw. So we'll see all these opportunities coming in, and we're working with many universities and surgeons to make sure that we remain at the forefront, to make sure that our applications are always put out there.
Gentlemen, it's been a fascinating conversation, not just about Osteopore, but also the challenges around the technology and the opportunities around the technology. But before we leave, any final thoughts you'd like to leave us with? And we'll start with Dr. Jing first.
Sure. I think that this industry is really shaping up to be one that's very dynamic and has a lot of potential. From a technology standpoint, we've seen different types of 3D printers now available on the market. A lot of them have tuned their 3D printers for medical purposes. From a design perspective, there are a lot of very creative and organic designs that have come up recently. And along with that, the regulations have also caught up and said that, hey, look, I think we can help companies get good products out into the market using this combination of technology. So I think what we are happy to do at Osteopore is to really contribute to the healthcare ecosystem, generally improve the standard of care, bring our products out there and really impact patients' lives.
Now, Mark, your final thoughts?
I think we encourage everybody to embrace medical technology. Now the days of 3D printing and helping to regrow bones, tendon, and ligaments is a real possibility now. It's happening with bones and it will happen with the other soft tissues. So embrace technology. Who knows, in another decade or so, you could print body parts, right, through our 3D printers. So, I think let's be excited about the future, and medtech is here to help everybody.
Now, gentlemen, thank you very much for taking your time to be on the show.
Thanks, Brian.
Thank you, Brian.
I'm Brian Fernandez, and we've been speaking to Mark Leong, Chairman of Osteopore, as well as Dr. Lim Jing, COO and CTO of Osteopore, on BizTech's Health and Wellness Show. This video and podcast will be on our various social media platforms, as well as our website, www.biztech.asia. It will also be on our syndication partners, TV stations, radio stations, and websites. Thanks a lot for tuning in.